Some people don't just think about what could happen. They think about what could go wrong. Not occasionally, not in extreme situations, but as a pattern. A conversation is replayed before it even happens. A plan is followed by a quiet list of everything that might fail. A normal situation is accompanied by a parallel version where things don't go as expected. From the outside, it can look like negativity, pessimism, or overthinking. But psychologically, this pattern is rarely about expecting the worst. It's about trying to be ready for it. There's a certain kind of person whose mind naturally scans for risk. Not in an obvious, anxious way all the time, but in a structured, almost automatic process. They don't just imagine outcomes, they simulate them. Multiple versions, different variables, different consequences. And among those simulations, the worst-case scenario often stands out, not because they want it to happen, but because they want to understand it before it does. At its core, this behavior is linked to anticipatory thinking. The brain attempts to reduce uncertainty by predicting outcomes in advance. For some individuals, this system is more active. Instead of stopping at the most likely scenario, it continues. It explores less probable outcomes, including negative ones. This creates a broader mental map of possibilities. The benefit is preparedness. The cost is mental load. The first major trait is a heightened sensitivity to uncertainty. Uncertainty creates discomfort. The mind doesn't like incomplete information. For individuals who think in worst-case scenarios, this discomfort is stronger. They respond by trying to fill in the gaps. If the outcome is unknown, they imagine it. And often, the mind prioritizes negative possibilities because they carry more potential impact. Understanding the worst feels like reducing the unknown. The second trait is risk-oriented pattern recognition. These individuals are not randomly imagining problems. They are connecting patterns. Past experiences, observed outcomes, indirect information, all of these feed into their predictions. If something has gone wrong before, or could logically go wrong, it becomes part of the model. Over time, the brain becomes efficient at identifying potential points of failure. The third trait is a desire for control. Thinking through worst-case scenarios creates a sense of preparation. If you can imagine it, you can plan for it. Even if the scenario never happens, the act of thinking about it creates a feeling of readiness. This is not full control, but it reduces the sense of being unprepared. The fourth trait is emotional preprocessing. Instead of reacting to events as they happen, these individuals often process emotions in advance. They imagine how they would feel if something went wrong. They experience a version of that emotion ahead of time. This can reduce shock if the event occurs, but it also means experiencing negative emotion more frequently, even without real events triggering it. The fifth trait is cognitive endurance. Thinking through multiple scenarios requires mental effort. People who do this regularly often have a higher tolerance for extended thinking. They can stay with a thought longer, explore it deeper, and follow it through multiple outcomes. This is not always comfortable, but it is sustained. The sixth trait is difficulty with closure. Because the mind is generating multiple possibilities, it doesn't easily settle on one conclusion. Even if a situation seems resolved, the brain may continue to search for additional outcomes. What if something else happens? This creates a loop where thinking continues beyond what is necessary. The seventh trait is protective intention. At a deeper level, this pattern is often about protection. The goal is not to feel worse. It is to avoid being caught off guard. The brain prioritizes negative scenarios because they are more costly if ignored. Missing a positive outcome has little consequence. Missing a negative one can have a high cost. So the system prioritizes what feels more important to anticipate. However, this pattern is often misunderstood. From the outside, it can look like pessimism. But pessimism assumes negative outcomes without analysis. This pattern is analytical. It is structured. It is based on simulation, not assumption. The individual is not necessarily expecting the worst. They are exploring it. There is also a difference between useful anticipation and excessive rumination. When worst-case thinking leads to preparation, it serves a function. It helps with planning, risk management, and decision-making. But when it becomes repetitive without resolution, it turns into rumination. The same scenario is revisited without new information. This increases anxiety without increasing clarity. Another important factor is past experience. Individuals who have experienced unexpected negative outcomes often develop stronger anticipatory systems. The brain learns that things can go wrong without warning. As a result, it tries to predict more. This is not irrational, it is adaptive. But it can become overactive if not balanced. There is also a neurological component. The brain is naturally biased toward negative information. Negative events are processed more strongly because they are more relevant to survival. For some individuals, this bias is amplified. Their attention is drawn more quickly to potential problems than to neutral or positive outcomes. Interestingly, people who think about worst-case scenarios are often good at problem solving. Because they identify potential issues early, they can plan around them. They may appear cautious, but their thinking can prevent mistakes. In environments where risk management is important, this becomes a strength. There is also a social dimension. These individuals may be seen as overly cautious or even draining in conversation if they focus too much on what could go wrong. But in structured contexts, their input can be valuable. They see what others overlook. Another layer involves time perception. Worst-case thinking often projects into the future. The mind moves ahead of the present moment. This can reduce presence. Instead of engaging fully with what is happening, attention is partially allocated to what might happen. Balancing future thinking with present awareness becomes important. There is also an emotional trade-off. By thinking through negative scenarios in advance, individuals reduce the intensity of surprise if something goes wrong. But they increase the frequency of negative emotional experience overall. They feel a little bit of the worst-case scenario many times, instead of possibly feeling it once. From a psychological perspective, this pattern is not about expecting failure. It is about trying to avoid being unprepared for it. It is about building a mental model that includes not just what is likely, but what is possible. And once you understand that, worst-case thinking stops looking like negativity. It starts looking like a form of protection, a system that is trying to reduce uncertainty by expanding awareness. The challenge is not to eliminate this system. It is to regulate it, to know when to stop the simulation, to recognize when thinking is no longer adding clarity. Because the same mind that can prepare you for what might go wrong can also keep you stuck in possibilities that never happen. Personally, I've always found that thinking about worst-case scenarios can feel strangely reassuring at first, because it creates a sense of control. But over time, it becomes clear that not every possibility needs to be explored to feel prepared. Sometimes clarity comes not from thinking through every outcome, but from knowing when to stop. And maybe that's the balance people don't often talk about. The ability to prepare without letting preparation turn into constant anticipation of things that may never come.